Welcome back. It's Dr. Jen Boney, Doctor of Physical Therapy, better known as DocJenFit, owner and founder of Gen Health, your platform for all aches and pains that you might be having, or just wanting to follow a plan to feel good within your body. Now, today I want to talk about calf cramping because this is something so common in pregnancy, and I did not experience it within my first pregnancy, actually, but I have experienced it within this pregnancy, and there are some key elements that have really helped to reduce some of that calf cramping. And one thing that I will say right off the bat is when I'm stretching at night, you know how you kind of do like that full body stretch and you just stretch out your legs. One thing I make sure not to do right now is point my toes with that stretch. I flex my toes back toward me and then I stretch my legs. And that's helped to reduce those instances. So I will say that right off the bat has been helpful, but this flow has really been helpful as well to make sure that I'm maintaining my mobility all the way from my low back all the way down to my foot. Like, this is crucial. Following that entire line of where that sciatic nerve goes through is going to be so crucial to help that nerve continue to glide, to help things continue to relax. And so that we're hopefully reducing some of that calf cramping. Now, I do want to say really quickly as well, something that I have super noticed is that if I am not taking my electrolytes, I increase my instances and chances of having that calf cramping. And as soon as I added my electrolytes back in, no more calf cramping. So I'm just going to drop the link below. It is our drink element link, and it's just been so crucial during pregnancy and especially postpartum. So for my mamas out there, this one is a good one and I highly recommend. Okay. We're going to get right into it. So we're going to start with a cat-cow. Okay. Now we're going to go through your typical cat-cow. Hands underneath you. If it's too much on your wrist, you can always fold up your mat and stack your palms a little bit higher, or put your elbows on something like a ottoman. Okay. If it's really just your wrists are not having it. Okay. For a cat-cow, I really want you to think of dropping your shoulder blades back, extending all the way through that upper back, all the way down to that tailbone, and then pressing into the ground. So think of your fingertips pushing into the ground and then tucking that tailbone under, tucking your chin. And it doesn't really matter, your breath pattern here. It really is what feels best to you and feels most open for your body. So I'm not going to instruct you technically on the breath pattern that you should do, because you can inhale at the top and expand from the rib cage. You can inhale at the bottom and pull the shoulder blades together, exhale at the top. So really, it's just what feels best within your own body. Explore both of them. You know, sometimes we get stuck in one way of doing a breath pattern because maybe we've heard it in like a yoga class or something, but exploring the breath in all directions is really helpful. And especially pushing through your fingertips really helps to take pressure off of those wrists. So make sure that as you're pressing at the top, you're pushing into those fingertips, and that's going to help you to get all the way through that spine. We'll just do one more. So we're doing about 5. And then from there, we're going to alternate it to just focusing on the low back. And this is something that we don't do enough. So push into your fingertips and lock out that upper back. And I just want you to tip that pelvis as far forward as you can and then untuck. Exhale. Sometimes I like to exhale here. You can explore both ways, but it helps to kind of wrap that belly up and in. And then really tip, and then exhale. Or inhale. Again, like I said, you can listen to your body, but I just find that it helps to pull that pelvic floor and transverse abdominis on with an exhale. Round through that pelvis as much as possible, and getting that low back to move, because sometimes we get super stiff and tense during pregnancy and we forget to move into that low back in all different directions. Okay. So just about 5 here. And this can be something that's like your morning routine. Every morning, you're going to do 5 cat-cows, 5 lumbar cat-cows, and you're going to really utilize that movement in through that back. Okay. Then, and this is something that you can also do in bed. Before you even sit up and do the cat-cows, you can actually do sciatic nerve glides. So we're going to grab into the back of the leg here, And I'm just going to start by pointing my toe up to the ceiling. If that feels okay and I'm not feeling anything from a flex to a point, there's no increased tension, there's no pain, then I'm going to actually take my toe back toward my face. And this is like a great one to do 5 to 10 in the morning. Like I'm telling you, once I start to pull my toe back, I'm going to feel that stretch a little bit lower, right into my calf. And that's actually the nerve. So it's not technically a calf stretch. It's more of a nerve glide by getting that movement through that tissue. It can be really helpful in maintaining that mobility of that tissue, especially if we get a lot of swelling on the lower body. Making sure that we're moving that nerve through the tissue every single day is going to be really helpful. So the toe only comes back as much as you can tolerate. You definitely don't want any increased low back pain or anything like that. And if laying on your back is really uncomfortable, because for some people it can be, you can always switch to doing this standing, and I'll show you how to do that at the end. Okay. So for some people, they might notice that they get out of breath, they feel dizzy, they feel nauseous. But I also want to tell you that laying on your back for just a little bit of time when you're doing a movement or exercise is totally fine. Just like we get checked usually on our back during pregnancy. But if it feels just really uncomfortable for you, then that's where switching it up to a standing sciatic nerve glide. And again, I'll show you how to do that at the end if it's really uncomfortable for you to be on your back and doing that. So it's about 5 to 10 on each side. Doing that every day, I'm telling you, so crucial. As well as making sure we're maintaining our mobility within the calf. So this is where I can pull in like a chair, a counter, anything that you can lean over and just get a stretch in. It doesn't have to be very complicated, right, to get a calf stretch. But we forget to do this throughout the day. And then all of a sudden we're cramping, we can barely walk, but we haven't been maintaining our mobility. So with a calf stretch, rather than just holding it 10 to 30 seconds, we actually want a little bit longer, at least a minute. Okay. If not 2, to really talk to that nervous system and melt into that tension and relax. Or just focusing on 10 slow, deep breaths. So it looks like this. The slower, the better. And you're going to notice you're going to get to a minute real quick, and you're not going to have to like watch the timer, count down. So at least 10 slow breaths, making sure that you're melting into it, making sure that you're not in pain and wincing. So you can always back off as needed, and try to get into the position that feels comfortable for you. We want to try to keep your hips stable, your foot as straight as it feels comfortable, and then you lean forward to what your body can handle and take deep breaths. And as you take each breath, if you notice, oh, I'm feeling like relaxation, I can move a little bit further. That's fine. We just don't want to go too fast too soon. So it's more about the longevity, right? So if I could do this every day over time, it's not about how far I can go or how much I can stretch within the first time. It's more about how often I'm doing it throughout the day. Okay. Now I want to show also a quick nerve glide standing. So you can actually use that elevated surface, kick that foot on, drive those hips back, and bring your toe up towards you. Okay, so this is a modification from laying on your back. If laying on your back is just not feeling good, you can hold on to something. It doesn't have to be a balance exercise, but just bringing that toe back, making sure you're not getting any low back pain. So only going to what is tolerable for you, bending directly at those hips and not rounding. So just like when we're on our back laying on your back is completely flat, right? So same thing here. We want to actually take those hip bones forward and then draw the toe back towards you. And you only bend as far forward until you feel that stretch down into that lower leg. Okay. And that's a good way to get that sciatic nerve glide. And another good way to just get all the way down the back chain of the body is just doing a standing hamstring. So again, I want to take that tailbone and tuck it out. So lift it up, hip bones forward into my thighs, a small bend at my knees, and I just rock back into that hamstring stretch and then come up. And if you want to feel it a little bit more intensely, or you want to get into that nerve a little bit more, you can always elevate the toes onto like a small pillow or a towel, a wedge a little bit more. Okay. But you don't have to. This is a great way to just get into all the way from the low back, all the way down into those hamstrings. And if you feel it into the calf, then it's getting a little bit into that nerve as well. You just do about 5 to 10 of these throughout the day. And I'm telling you, if you maintain this routine, plus taking your electrolytes, plus making sure you're not overstraining in that calf, you're going to help to reduce those symptoms of that calf cramping, because we want to keep the body moving. So if you are not doing mobility, I do have a full body mobility plan on Gen Health, and it's helped me to reduce so many aches and pains around the pelvis, around ligament pain. That's super common, low back, SI issues by doing and following this full body mobility plan. It takes 5 to 15 minutes a day. It doesn't take very long. There's multiple phases so that you can continue doing it and you don't have to think. That is the number one thing in pregnancy. You're already losing your mind. So rather than having to think or come back to doing the same thing over and over again, try our full body mobility plan. It's going to take you from head to toe into really opening up the body. And it's helped me so much in my pregnancy. I keep coming back to this plan. So I'm going to actually give you a little code. You can use code OPTIMAL and you get a little discount coming into your first month, but you also get to just explore a week completely free. So I'd highly, highly recommend our full body mobility plan. We're going to have that linked up around and below, and check it out. Do something good for your body this pregnancy that feels so nourishing.
Don't forget, if you love what you're learning, I have so much more in stock for you. So hit that subscribe button, check out the other videos I've done in the past, and leave any comments of any suggestions that you have for videos in the future. And I can't wait to help you feel incredible and amazing within your body.